Hello, it's Dr. Rhonda Johnson. Today is Wednesday, September 22nd, 2021. And today I'm going to be talking about COVID, kids, vaccines, and what's going on with our schools. Well, since the pandemic began, sadly, more than 5 million children in the United States have tested positive for COVID, with over 1 million of these children infections occurring in the past month. Now, nationally, the peak of infections are in kids between the ages of 5 to 17, and of course that correlates with kids going back to school. But folks, school is not the only activity that is driving COVID rates up in children. We're 18 months into this pandemic, and we all have COVID fatigue. Everybody's out and about. People are back in restaurants, they're in church and movie theaters, bars. Well, kids aren't in bars, of course, but their parents may be. Festivals, parades, sports events, birthday parties, family gatherings, concerts. People are traveling and they're going everywhere, here, there, and everywhere. And people are coming into a lot of contact with other people. And again, we're in a state politically where whether one wears a mask or doesn't seems to be a matter of individual choice. So our kids are becoming infected with COVID, and they're transmitting it also. Now, fortunately, kids are at a lower risk for serious illness from COVID, and they're at a lower risk for hospitalization and death. But the risk is not zero for children, because all across the United States, record numbers of children are showing up in the emergency rooms of hospitals, and they're being admitted to the hospitals. Now, what are the COVID symptoms in children? Well, it's very similar to adults. Now, I want to qualify. This is not a talk about babies. I'll do a talk about babies separately. So in children, the symptoms are fever, chills, cough, shortness of breath. Those are the most commonly reported symptoms in kids 5 to 18. But they also can have muscle aches, runny nose, sore throat, headache, nausea, vomiting, abdominal pain, diarrhea, and a loss of taste and smell. And remember that each person's presentation with COVID might be slightly different. Again, COVID doesn't seem to be as deadly as in adults. Fewer than 500 children have died, but again, we hate to lose a child. And most of these children who have died are Black and Hispanic. So, the CDC published a study this month that said hospitalization rates were 10 times higher in unvaccinated kids than among fully vaccinated kids. And we know only kids 12 and up can be vaccinated, but still that would go a long way if we could get kids 12 and up vaccinated. Now, parents, you got to remember that kids can get long COVID too. Not a whole lot is known about long COVID in children, but commonly reported symptoms include fatigue, headache, sleep disruption, muscle and joint pain, respiratory problems, palpitations, and altered sense of taste and smell. And if you have a child who has COVID, parents, your child's going to need long-term follow-up with their pediatricians. Now I'm going to switch gear. I'm going to talk about the recent developments with vaccines for children 5 to 11. Well, you've probably heard that Pfizer has completed its clinical trials in children ages 5 to 11 and will be submitting that data to the FDA. They had over 2,200 kids enrolled in their clinical trials. They used a dose that is 1/3 the dose that is currently being used for people 12 and up. Pfizer is saying their vaccine is safe for kids, and the kids have fewer side effects, such as sore arms, fevers, or achiness at that dose. Now, again, this is expected to go to the FDA, and the doctors who are experts on TV are saying that kids should be getting shots in the arms by Halloween. We'll just have to see. Now, Moderna is also doing vaccine trials on children, so we'll be waiting to see what their data look like too. What are other countries doing in the world? Because sometimes you need to have a global perspective on a global pandemic. Well, Cuba began immunizing children with their own homegrown vaccine as young as 2 last month. And Chinese health officials have approved 2 of their vaccines for kids as young as 3 years of age. So Americans need to know that they're not going to be the only country who are going to be vaccinating young children. So what's going on in the schools? Well, if you've heard anything, you know that schools have had trouble with COVID this school year. More than 2,000 schools across the United States have had to close since the start of this school year because of COVID. So what's going on? What can schools do to help keep the students enrolled in school? Because we all know that school closures are very disruptive to parents, and they're disruptive to children's learning as well. So, you know, earlier this summer, the CDC established a playbook for keeping schools open, and I've done a couple videos on this. And part of their playbook include ventilation, social distancing for 3 feet apart, mask wearing, and testing. The government has provided money to the states for testing for children in schools to get COVID tests. Now, some school districts aren't doing this, even though money is available. But some are doing what's called pooled testing, P-O-O-L-E-D, where they test a classroom or orchestra or a sports team, and they test weekly. And if somebody comes back positive, if that pool test comes back positive, then they test to see who individually tests positive, and those students are quarantined. Now, recently, some states, school districts in Massachusetts, Georgia, Illinois, Utah, and California, they've been doing a new approach called Test and Stay, which is basically a modified quarantine protocol that allows kids to stay in school as long as they're tested regularly on a daily basis and wear masks and social distancing. So what happens is they do the pool testing, and if, again, a child has had close contact and is asymptomatic, but someone tests positive in the cohort, each of those children are given a rapid test daily for 7 days instead of quarantining at home for a week to 10 days, because this is going to keep rolling out in schools, and kids could end up spending more time at home in virtual learning than they can in person in classroom. So this is called the Test and Stay approach. The CDC has not endorsed this, but they're watching it. They're collecting the data, and they say, you know, they want more data before recommending it. So again, parents, for any testing program, you have to consent to have your kid tested in school. Most kids can do the test themselves. It's just a little tiny Q-tip swab that goes up their noses. And as a pediatrician, I can tell you kids can put a lot of things in their noses, so they can certainly put a Q-tip in their nose. And again, the results are pooled. They're all tested together. And again, this is free to all the school districts. So hopefully, parents, you will sign on to this. And again, we need to do everything we can to protect our children. If there's an upside to this, it's just that children will develop natural immunity, which may be stronger than vaccine immunity. But again, if their parents aren't vaccinated and they have high-risk people in their house, even though kids may not get that sick, it may cause their parents and caregivers to be very sick depending on their health risks. So mask up. Think before you go out, folks. Wear your mask if you're over 2. Keep washing your hands and stay safe. As always, this is Dr. Rhonda Johnson. My views are my own. My only intent is to help save lives. Have a blessed day.